All right, today we're going to be going through how tissue grows and how it repairs itself. Now, every kind of tissue has a different amount that it can regenerate or repair itself. For example, the liver is capable of complete regeneration, unless, of course, it's due to alcohol abuse, in which case it isn't. And the liver scar is over. We call that cirrhosis of the liver. We've all seen, if you've had any kind of surgery, you've probably seen something like this. Okay, now tissue, damaged tissue can, basically have two forms of repair. What you're seeing right here in this picture here is probably going to end up being a little bit of each. For example, one form of repair is regeneration. Regeneration, I would think, would be the preferred, way to repair damaged tissue, because regeneration simply replaces the dead or damaged cells with original cells. So there's really no loss of function. The other type of way damaged tissue can be repaired is through fibrosis. Fibrosis is the replacement of tissue with fibrous tissue. So in this case, you would have the damaged tissue replaced with maybe collagen fibers, which are, remember, white fibers, and you're going to result in a scar. The picture I've got here for you, this person probably had a lot of regeneration, but you might still see a small little white line, the scar, which is going to be fibrosis. So again, surgeries like this, you might see both types. The steps of healing a cut, like you see right here. Not to gross anybody out, I chose the pictures. This would be like, let's say, for example, a pretty deep cut. Not a paper cut, something a little bit deeper. And what you see happening here is, obviously, the blood leaks into the connective tissue. Now, I'm focusing more on the connective tissue, which is right down here. And remember, in the connective tissue, you have cells called mast cells. When you get a cut like this, one of the things that happens is the mast cells secrete histamine, which, remember, is a vasodilator. So the blood vessels will expand and become very leaky. So they're going to start forcing plasma out and other fluids out in an effort to try to wash away any kind of pathogens. And they're going to promote some blood flow into the area by also releasing heparin, which is an anticoagulant. So both things together are going to start the immune response here, try to protect your body from any infection by trying to wash the pathogens away first. Fibroblasts to start forming new fibers to branch across here. Now, the purpose of these fibroblasts making the fibers is to try to bridge across the gap. You'll see on the next slide. Start to form a bridge across there to tie the tissues together. Leukocytes, as I put up there, also going to be starting to clean up any kind of bacteria. Now, as healing progresses, the fibroblasts, like I showed you in the last slide, the fibroblasts are going to start forming all the way across. Macrophages still present to try to keep cleaning up the debris in the area, which would be damaged tissues, bacteria, and you're going to start having capillaries start to flow through the area. This is why when you first see a scab fall off, you see the scab at the top. When a scab first falls off, the tissue looks very, very pink. Well, got a lot of blood flow going through there. And if we go to the next slide, you start seeing some of the epithelial tissue regenerating, and they'll grow across. And that's why the scab eventually falls off. If the epithelial tissues completely bridge the gap there, no need for the scab anymore. But if a scab should be scraped off accidentally, at the later stages of this, the skin is very thin. And you're also going to have at this point, in this kind of a cut like this that's shown really deep, you're going to have lots of fibers across here. And those are collagen fibers, so they are going to appear white. Now, anytime you damage connective tissue, you are going to see little white stretch marks. Okay, for women, like after childbirth, they have the stretch marks because the connective tissue was stretched. Overweight men start losing weight, they can actually develop stretch marks. More often than I see the men here bragging about the stretch marks they got from doing all these bench presses up in their shoulder areas. But a stretch mark is just white collagen fibers that are formed as a process of repairing the connective tissue. Now, when I was an athlete in high school, I was always told never start lifting weights because when you quit, the muscle's going to turn to fat. Well, for the most part, that's not true. There are a few cases, though, as we're going to start off with here. There are some times there where one type of tissue is changing from one type to another. That can happen, but not in mature tissue normally. This is only going to occur, in what we call differentiation in unspecialized tissues. So that's why stem cell research is offering so many cures. Those cells in there are undifferentiated. They're not set to become skin cells or muscle cells or heart cells or anything special. But they can differentiate into just about anything. So in that case, we can have one type of tissue changing into another. But it's important to remember it's unspecialized tissue, so we're still looking at fetal development. Now, can mature tissue change from one form to another? Answer is yes, within limits. That's called metaplasia. That's changing from one type of mature tissue to another. There's only a few kinds of examples, only one example that I could think of. In the prepubescent female, simple cuboidal epithelium lines the vagina. After puberty, that tissue is replaced with stratified squamous epithelium in preparation for childbirth. Remember, stratified squamous epithelium is responsible for protection against wear and tear and friction. Okay? So, and during childbirth, there's going to be a lot of that. Growing tissue. I've got three types of growth here that I'd like you to know. The first one is hyperplasia. Remember, the prefix hyper means above or greater. In this case, we're talking about growth through cell multiplication. You just get more cells. Normal growth, getting taller, is basically hyperplasia. So while hyperplasia is common in the growth process, hypertrophy is simply the enlargement of existing cells. A real good example of this is muscle development. Your muscles get bigger not so much because you grow more muscle fibers, but you enlarge the muscle fibers you have. Now, the third type of tissue growth is an abnormal tissue growth. That's neoplasia. This is growth of a tumor. So cancerous growth would be an example of neoplasia. And that means whether it's benign or malignant, just growth of any kind of tissue or growth of any kind of tumor. Now, tissues do shrink and tissues do die. Now, the term we use to describe the shrinkage is called atrophy. Atrophy refers to any kind of tissue shrinkage, either from cell loss or the cell size. So, if your arm is in a cast and your muscles shrink in your arm, you didn't lose so much cells as much as you lost size. The cells shrunk from disuse. As you get older, though, and tissue doesn't repair itself as fast, you probably decrease in the number of cells. Now, a nice term to know is necrosis. Necrosis is bad. It's the pathological death of tissue. Now, most people know gangrene. Gangrene is tissue death and generally attributed to insufficient blood supply. And there can be gas gangrene, but most gangrene that people are aware of come in like pressure sores or sebaceous ulcers. If you know anybody that's got a bed sore or pressure sore, sitting in one spot for long periods of time, like in a wheelchair or confined to bed, you'll develop these pressure sores from just your body weight pressing down on that one spot. You restrict the blood flow, and the tissue that is supplied by that blood dies. Now, cell death, besides necrosis, even before birth, we have some cells dying. That's called apoptosis, programmed cell death. The example I've used for years is in a fetus, right before birth, or several weeks before birth, you have webbing between your fingers and toes. Yet it's very rare that a baby is going to be born with webbing between their fingers and toes. Those cells shrink and are destroyed by the lysosomes long before you're born. So you're born with 5 fingers, 5 toes.